Good evening. Welcome to SiddhaVetha webinar series. Today we have a important speaker. He's based in the US. He's going to talk on the rationale of MIT based workplace mind-body fitness program. But the topic is basically the challenges and approach to bring traditional medicine into mainstream. So that's what he's concentrating on. So a bit about Dr. Narayan. He has a PhD and a CIAYT, is the Chief Clinical and Researcher of Life in Yoga's Measured Yoga Therapy. That's what MYT means. And serves as the Executive Director of two nonprofits. One, the Life in Yoga Foundation, estimated in 2006. And two, Life in Yoga Institute in 2011 estimated. So Dr. Narayan, most recent publication, Bioenergy and its Implication of Yoga Therapy, reflects its research on several years. He shared with me. It's a wonderful paper. He led Life in Yoga Institute to become the first yoga institution to get independent accreditation to give CME credits, which is very important for doctors. So he started that in 2014. He established the therapy center in Maryland 2013. Since 2016, beginning with the curing of an incurable condition, chronic fatigue syndrome. He treated a Houston philanthropist successfully, and therefore he was able to establish a clinic in Houston in October 2016. Starting Jan 2018, a clinic has been established in Phoenix, Arizona as well. He is preparing to bring yoga, Life in Yoga services to North California. His focus at this time is to bring the benefits of measured yoga therapy to employees of companies through the company's management, with the goal of bringing better health to employees and also increase productivity and healthcare costs. So it's a brief description. He has a lot of achievements that is not reflected here, but I will now ask Dr. Rajan Narayan to take over.
Namaste, everyone. The topic that Sean and I discussed before we had this put together was precisely what he said. Well, the title is there. The real thing is challenges and approaches to bring traditional medicine to mainstream. So I will go through a quick PowerPoint presentation so that we can be to the point, and at the same time we can keep to the timing. Let me make sure I put it on over here. Okay. So the first topic I'll talk about is forces behind ballooning healthcare costs. And then we will go on to traditional medicine and how it could play a disruptive role. And then how we can change healthcare through employers. And then a brief on what Life in Yoga Institute is all about, what we are doing. So if we are looking at the forces behind ballooning healthcare costs, because we have a wide variety of people, we want to get first an appreciation for what is this business about, ballooning of healthcare costs. In 1965, the Medicare program, essentially the major health insurance system of the United States, was established. If you look at the share of the healthcare dollars in 1960, it was about 5%. And today, it is 18.2%. And if you try to say between 1960 and 1965, it was in the 5 to around 6% or so. We are looking at tripling of the share of the GNP. Tripling of the share of the GNP should be considered in light of how much healthcare costs have increased, but also how it has changed around the world in other countries. Because medical science has also advanced. There are many good things that have come from it. And accordingly, some of the costs may have increased. But is this level of increase in the share of the GNP justified? For that, you need to make the comparison. If you look at the United States is spending over $10,000 per person on healthcare annually. Whereas on the other hand, if you look at Canada, for instance, they are spending $4,752. This is all in 2016 dollars, okay? And so you can imagine US is spending a lot more money than other advanced countries of the world. And the status of health is not particularly better than other places. If you look at how the US expenses have always been or have continued to be higher from 1970s, if you look at, you will see it was around 6% around in 1970 for US, and now it is like 18%. But for the rest of the world, you see that, or the advanced countries, starting from somewhere around 5% in 1970, now they are about a shade above 10%, close to 11%. So there is a very big gap over there. And why is this happening is a good place to understand the dynamics that go into a modern medicine, why costs are increasing. The first thing to understand is, while anatomy and physiology of a person may be known, when it comes to therapy for a patient, medical science today is a statistical science. One therapy that may suit for someone may not suit somebody else. And more so, when people are looking from a medical standpoint to suggest something is working statistically, they may not necessarily be looking to cure the patient as much how they are able to restrain the symptoms or reduce the symptoms that are caused by the condition. So they may say how well the sugar level is being kept by a medication for diabetes, or how blood pressure is being maintained by a medication. So they are looking at how much the blood pressure dropped or how much the sugar dropped, but not necessarily in terms of whether they're curing diabetes or blood pressure. So this is how the statistical science works. And effectively, to justify that this is a valid way of practicing, and in their view, this is their best known scientific knowledge that they have, they call this as the standard of care. Now, the standard of care has evolved. Going back 50 years, the physicians had a lot more latitude as to how they wanted to deal with patients. But over the years, today's standard of care has become the basis for liability protection for the physicians. And so let's take a look at how the evolution has happened. And if you as a person, if you go to a doctor, how it begins. And this gives you a sense in terms of the forces behind the modern medicine's healthcare cost. If you as a patient needed any assistance from a healthcare provider, and pretty much most of the country, in fact, we are still within Obamacare, only from next year on that changes. Pretty much everybody in the population is covered. And so your health insurance and your health providers are determining what treatment is going to come to you as a patient when you go with an issue. And how will they treat you? They will treat you based upon the standard of care that has evolved. How did the standard of care come about, and what is the basis of it? The standard of care, as I've already said, came because of liability protection for physicians, to say this is the standard. So if I apply the standard and if I do damage to the patient or kill the patient, there is no liability on me because this is the best known knowledge. Now, the standard of care is, while it is a liability protection for the people, how did it come about? It really, I'll make the argument, it really came about as a result of once health insurance came in. Prior to health insurance, if you went to a doctor, they will look at and they'll say, if you're a poor person, they'll say, okay, you can give $1 or $5. And if you're a regular patient, they may charge you $20 for the visit and you're done. You're paid out of your pocket. But once health insurance came along, the attitude of it where you're not paying for it, somebody else is paying for it, how does it matter? So they started billing more. And not only that, as they started billing more, they also realized the more they billed and the more patients they had, they made more money. And from a patient-focused business, it became a kind of a revenue-focused business. And when people start doing that, like a assembly line process, then in which case mistakes will occur. And because of the mistakes, they all came together. Of course, they carry liability insurance, what is typically called in the medicine as the malpractice insurance. And so through the American Medical Association, they established that if a person is diagnosed with this is the first line of treatment, second line of treatment, and things like that. And if anybody deviated out of that and there was negative results for the patient, then in which case they expose themselves to liability. So no physician in the regular business wants to do that. So when it comes to traditional medicine and anything that would come in, no regular physician will ever bring that in because that is not the standard of care. No, because as part of running a business, that has become the modality, and it is completely based on statistical science, where they have proved the medicine or the approach that they are taking on average is helping the patients for a specific condition. But what is the meaning on average? On average means that if you have 100 people who are on this improved system, and previously there were another 100 people who were suffering from the same thing without medication or on some other system, you will find that maybe between the two groups, if you're looking at blood pressure, this new approach may reduce the blood pressure another 5 points more on average. But on average, if you're talking about it, it means maybe for about 20% of the people, the drop in blood pressure may be like 30 points down. And for the bulk of the people, maybe like 50% of them, it may actually be about maybe 5% down. And then there may be actually people for whom another 30 or 20% of the people for whom blood pressure may actually have gone up because of the medication. Whereas, so averages don't tell the whole story, but that is the basis on which medicine is determined. And the few people who are in pharmacology will know even dosage of medication is based upon averages. And typical pharmacologists will say, when they determine dosages, typically 50% of the population gets less dosage than needed, and the other 50% get more than they need. So the toxicity of the medication is higher. Of course, what they do is they work in a way where they try to, where they can make sure that the bell curve around which they work, the normal distribution, is a narrow distribution so that the standard deviation is not too high. But that's how standard of care as a statistical science works, established by the American Medical Association. Once that got in there, this essentially became the way for the pharmaceutical and device manufacturers to prove anything new that they come up is better than something previously, and therefore that becomes the new standard of care. So they push that. And of course, from the government side, as well as legislative lobbies, they have all agreed, okay, this is the system that we are going to work with. Now, you can understand that the government does not work independently. They work largely based upon how lobbies fund. You all probably know that the Medicare, which is funded by the government, is a government organization. The Center for Medicare and Medicaid Services, they are not allowed to negotiate with pharmaceutical companies to reduce the cost of drugs, whereas all other private insurance companies are allowed to do that. So you can imagine how legislative lobbies have worked in such a way. And immediately you can see from here, the whole system is geared how to milk the cash cow from the system. So it is from the health insurance companies and from the government provided health insurance programs, how all the people who are involved in the medical business can milk the cow more effectively. That is how the whole system is built around. Just to understand the degree to which it works is, if you go further and look, if you look at how medical school costs have changed over the years, the medical school costs actually reflect that when a doctor goes to practice, they will be earning more, and therefore they can afford to take loans, and therefore they can have a higher medical school cost. Very few people realize that this is how they have come about, because what has happened is, over I came across the most egregious example, which has happened in the recent times. Why are there lines appearing on the screen? Am I doing something?
Maybe somebody else, I guess.
Okay.
If they wanted to ask or write, trying. Could you please do not do anything unless you have any questions? Sorry for the interruption. Please go ahead. I think
okay.
They will erase it. Okay. Thanks.
Yeah, that's fine. Okay. So one of the egregious examples that came to light is, some of you may know about the field of this endodontics, or the root canals that are done these days. If I think in terms of 50 years back, or even going back 30 years back, root canal was not a very well-known thing. Typically, if people had bad tooth and it could not be filled, then the only recourse people had to extract the teeth, and they would give you dentures. And then, of course, with the root canal coming on, the people who have not yet extracted the teeth, they can still have their teeth with the root canal. And originally, when they were working with it, it usually required 4 visits for the dentist to make sure that the nerve was properly taken out and there was no infection. And so the insurance decided they will reimburse $800 for the root canal. And as time went along, now these days, people can do a root canal in as little as 40 minutes in one session, or maybe in a couple of visits, and still they get reimbursed $800. So some people found it very effective to specialize only in root canal. And the dental schools decided, oh, if they are going to make so much money, we should create a certification program. And they created one program for that. And with that program of 18 months, where people are generally, they of course have a few courses, but most of the time they're working with patients with root canal. And at the end of that, for that, they pay $170,000 for 18 months of training over there. And then, of course, they know they can afford to pay it, because when they come out, even if they work elsewhere, they will make $300,000. And if they have their own practice, they will make a couple of $1 million annually. So this is how the system is rigged, how you can milk the system. And who pays for it? Employers pay for it, government pay for it, and individuals pay for it. But probably employers and government are really paying the lion's share of the cost. The blessings of modern medicine, if you look at it, is it's excellent for acute care. Heart attack, stroke, shock trauma, all of these, it is very good. Whereas when you think in terms of the curse of modern medicine, it is very limiting for chronic condition, because it is largely liability protection and revenue driven. The long-term toxicity of medications have negative impact. And in any case, the modern medical system is an incomplete system, lacking holistic understanding. In fact, most of the specializations have gone to a degree where if you go to a ENT physician for a ear problem, they completely ignore other parts of the body there may be. Of course, they are meant to look at if you have any heart condition and all of that, but nevertheless, when they work on it, if those are all taken care of, certain things, they generally are not focused on what impact what they do will have on the rest of the body. So this kind of, specialist-based approach can have a negative, sometimes effect on how treatment is done. Now, the evolutionary changes in medicine, if you look across, you can see how with the coming of the health insurance, it transitioned from a patient-driven to an industry-driven healthcare system. And there are blinders of the air of full knowledge. The degree of it is ridiculous. The modern medicine system and the training is anything that they don't know, nobody else can know. And therefore, the condition is given a technical term, and it's a diagnosis called an idiopathic condition. So if somebody has a headache that is coming on and they don't know what the reason is for, why they're getting the headache, it is called an idiopathic headache condition. Okay? And so now, going back quite a many years back, there was this understanding that traditional medicine systems had potential for doing a better job. So few people know that in October 1991, the Office of Alternative Medicine was actually legislated by Congress, and they allocated $2 million for it. At that point in time, there was a lot of criticism from the scientists at the National Institute of Health. These lawmakers are all stupid. They want us to go and work on quackery. This was the reaction that came from the Office of Alternative, from scientists and researchers. Then, of course, now, then in 1998, they realized that it is now, there is also a complementary element to it. So the name changed with a larger budget of National Center for Complementary and Alternative Medicine. And in December 2010, now the word alternative is completely gone. It is the National Center for Complementary Integrative Health. And of course, today its budget is in excess of $140 million. Now, despite the research, fundamental changes are lacking in the healthcare approach. And the approach is to find a way for all the people who are involved in the healthcare business, how they can get an extra bite from the health insurance pot. Even today, the International Association of Yoga Therapists is looking how they can also be qualified for the health insurance system so that they can also get a bite in there. And they don't want to get any objections from the other people. So they're all saying we don't conflict with the medical system. So this is the way we will approach it in a way where it only adds extra cost and does not reduce their cost, which is the income for the other people. So now we come to the traditional medicine and how we can develop a disruptive technology. The traditional medicine approach is based on yogic understanding as follows. On one hand, let me do the following. Somehow the scratches, wherever it came from, has not gone. So I'm going to close this and I'm going to open the program again so that we can clear this out.
Okay. Sorry about it. I think somebody might have just tried, doing some stuff, but they don't know how to erase. There is an erase button. They could erase it.
Okay.
But maybe in the setup, I should do that next time.
Okay. Now, how do I get out of the share?
Yeah. Hold on. Let me. Okay. You just stop share. There is a stop share option.
Oh yeah, stop share. Okay. And now it is cleared out. And so now we can go to share again.
Yeah. Okay.
Okay. So the traditional medicine measurement approach is based on the yogic understanding of three bodies, as they are often called. the spiritual body or the causal body, and then the subtle body, which is the electromagnetic communication that is happening within the body, and then the gross body, which is the physical, physiological entity. Now, in all traditional medicine systems, what has evolved is the way of using, particularly in Ayurveda and Chinese medicine system, they use the 3 fingers to go and assess a person. When they're assessing, while often it is called pulse reading, they are not actually interested in the heart rate as much as they are interested in the pattern of the throb that they feel. And based on this, they're assessing the communication within the body of different organ systems. And of course, some spiritual people, they don't even need to use the fingers. They can just, by looking at the person, they can find that out. Today, we have a mechanical system, essentially by putting, we call it as electro-photonic imaging. And well, that is coming in a later slide. You put a finger within within an electromagnetic field, and from there you can assess it. I'll show that in a later slide in a moment. So the yoga base of traditional medicine system is that the human system is a connected communicating system, and the philosophy comes through the idea of 3 bodies, 7 chakras and nadis that connect all of them. The chakras are the entry point of the causal body to the subtle body. So anything that we are measuring, we are only measuring it within that electromagnetic frame. And anything that goes into a deeper issue cannot be measured by the 3 fingers. And the assessment is that of the vibration of communication in the subtle body. And the objective is to restore the vibrations back to the original plan. I will not get here into the concept of Prakriti and Vikriti. Prakriti is the original plan of each person. And when there is a change from that, it is called Vikriti. And that is called the imbalance in the doshas. And so that goes into the Ayurvedic discussion, which I'm going to skip over here in the interest of time. When we use electrophotonic imaging, you put each of your 10 fingers one at a time into an electromagnetic field. And so this way, you get an aura for each finger. You get this aura for the right thumb, the right index finger, like that, each finger of the right hand, and then each finger of the left hand. And then the image that you get, the aura that you get, the amount of photons, it reflects the pixels of light over there, and they reflect the amount of photons that are there in the interaction. And that is used to calculate how much of communication energy is happening with each organ system. Now, the wedges you see over here, according to the Chinese system, each wedge reflects a different organ system based upon where the meridians are flowing. So this is how the calculation is done. So the calculation gives an objective number of energy that is there when this system is taken. Of course, there are all the scientific elements of how you calibrate right, and with the thousands of people who have been read, how you have the standards, and that's how you get the right number. That's a different matter. And in addition to looking at the total amount of energy in there, we also look for what is called entropy. Those of you who are from engineering, communication engineering background, understand entropy should be understood as garbling of information in energy flow. So the lower the entropy, it is better, there is more communication happening. So the amount of energy and the level of entropy is what tells us the degree to which proper communication is happening within the organ systems. This system essentially produces numbers between 0 and 10 for 41 organ systems that are listed over here. You can see for the head, the eyes, nose, all of these. For the cardiovascular system, you can see the respiratory system, the endocrine system. The musculoskeletal system is actually the central nervous system, the spine. And then you have the digestive system, you have the urinogenital system, and what they call as the nervous system is the peripheral nervous system and the immune system. So you get readings for all of these. And of course, the number 4 to 6 is normal. Greater than 6 indicates abnormal activation, which means The body is communicating a lot because there's a crisis. It's trying to figure out what is happening. And when it goes less than 4, it indicates weakness, which means body doesn't know how to correct the problem that is in there. Now, the process essentially, when we work with it, is we document medical history, lifestyle, and then we read with this machine, and we also read with the 3 fingers, and then we apply a suitable yoga therapy therapy based upon this assessment, and then we go and take a reading again to see how the numbers have changed. This is actually the traditional way in which the Ayurveda used to be practiced. In fact, Krishnamacharya Yoga Institution still practices that way, where they take the reading with the 3 fingers, and then they discover where the Vikriti is, and then they have the person do the practice, and then they go back and look to see whether the Vikriti is gravitating back towards the Prakriti. So this is the way whereby you can measure whether the yoga therapy is working. So really it is traditional system of holistic medicine, but now we use modern technology. It enables minimizing guesswork in treatment by predicting outcome at the individual level, and it can use non-invasive approaches that are in the province of individual health management. So this way you don't need a doctor, you don't need any kind of a thing that would be restricted by the FDA or anything like that. And this can work without conflicting with doctors' prescriptive medications. And when complex cases are involved, they will need to work with their doctors to see once the program, this is having impact, they will need to reduce their medication. And this, of course, can be sometimes challenging if their doctors don't believe in what is happening over here. I'm going to give you a few cases over here because a picture is worth many more than words. Here is a 42-year-old female who is a veterinarian who is always standing on her feet all day, and she was diagnosed with plantar fasciitis. And this is the pain sensation that comes at the bottom of the feet. And at night, particularly when she's sleeping, she would find it would prevent her from having a good night's sleep. It would come on. So when we took a reading within that 41 organ systems you saw, what we saw was, we saw a high number in the coccyx, which is the lowermost part of the spine, central nervous system. And we see the nervous system is at a 3 point, below normal, 3 point, the peripheral nervous system. So what we did was we had her do vagal stimulation, Ujjayi pranayama. And once she did that, immediately after, we take the measurement, the coccyx number has gone down. Remember, 4 to 6 is normal, so 8 is abnormally high. It has come lower. And at the same time, the peripheral nervous system has gone up. And the entropy coefficient has again gone down by 9% for the coccyx and by 7% for the peripheral nervous system. So we told her to do this, and within a week, she didn't have any of the problem anymore. In fact, from the second day itself, she was sleeping well. And then after 1 week, she didn't, there was no sensation at any time, at any point in time. Now, take the case of a person with an idiopathic headache condition. This is a 44-year-old male, and he was getting persistent headache every day. And the nature of the headache is that on work days, in the morning, he would typically find there is not much of a headache, maybe it's so low kind of a heaviness in the head, but by the time it became the afternoon time, it was a splitting headache. And on weekends, obviously it was a little better, and the headache would never get into a high level of headache. It will be very mild. Now, this person did MRI and various other things, and they couldn't find anything wrong with him. So he came to me, and at the time he came, this man did not believe. His father believed in yoga, and he kind of pushed him to come to me. He canceled his appointment 2 times because he had other engagements with family over the weekend, which was more important for him. And finally, he came one day after 2 cancellations. Third time when he came, he said, being a weekend, my pain level is at 2 out of 10 at this time. And so when we took the reading, we found it was at 3.86, the spine. This is the total calculation of the spine. and the peripheral nervous system was at 3.11. And so what we did in this case was we had him do a spinal alignment exercise where essentially he loosens the muscles around the vertebral column. And then that takes about 15 minutes. And immediately after doing that, we could see how the entropy changed. Of course, you can see that has gone down. But more importantly, what he said was, my pain was a 2 out of 10, now it is 0 out of 10. And again, he did this the first week. He said that except for one day, every other day he was headache free. And that one day when he got the pain in the afternoon, it never hit the 10. It was like a 4, it was like a 3 or 4 out of 10, and that was a particularly stressful day. And then from second week on, he never suffered the pain again, and he was pain-free ever after. Now, the third case is a little more shocking case. This is a case of vitiligo. This is a person who is 50 years old. And this person is was detected with vitiligo at the age of 10. He's from Chennai, and he had the benefit of getting Ayurvedic medications right from around the age of 10. And immediately the little vitiligo that was coming on stopped. And he has been taking this medication for 40 years. Then about 9 months before coming to me, he was detected with hypothyroidism, and he started taking levothyroxine. And 3 months before coming to me, his vitiligo started expanding and going all over. It started increasing quite a bit, and he got worried. When he came, when we took the reading, we found that the liver was far below normal. And so all we did was we asked him to do Bahya Kumbhaka, that is compression of the liver, that area. And immediately we could see the number change. The entropy also dropped. And 1 month later, when I call him, he says after practicing this, immediately the increase of the vitiligo stopped completely. So you can see the degree of it. I gave you 3 examples. You will find that in my paper, and there are many more examples over there. In the interest of time, I've kept more examples in the end. I don't think we'll have time for it. But now getting on to the next subject, changing healthcare through employers. We can clearly see that this approach can have tremendous benefit for individual people. But can such an approach reduce costs for employers? Namely, remember, employers are the people who are paying the lion's share of the health insurance costs for their employees. And those of you who know, group health insurance works in a way, how much your employee is charged this year will determine the rate, the insurance premium next year. So if employers are able to reduce the healthcare costs of their employees in 1 year, over a period of time, they can contain their healthcare costs. So to ask whether this can reduce cost or increase productivity, we have an example over here, a fully tested case study that was done, a scientific study done by Aetna. And then and it was done with lesser technology than what we are doing, and our own experience at Starpipe. Now, the Aetna, we have 2 of these workplace examples. You can see the Aetna example in this link over here, reported in New York Times in 2015. But the scientific study, you can see published in 2012. And you can see that right over here. And Aetna, and in the interest of time, I'm going to go a little fast. You can look up all of these studies by yourself, looking over there. But the impact of it was in Aetna. In their 50,000 employee base, about a quarter of them tried yoga and meditation, which was offered in their workplace. And with these practices, they found those who participated in it, they had 28% reduction in stress levels measured by psychological questionnaires. And then 20% had improvement in sleep quality, 19% reduction in pain. They found productivity gains, and their healthcare costs also went down. Now, we had the same experience with a smaller company with 140 employees in Houston. In the interest of time, I'm going to shoot a little bit forward over here. And To tell you a little bit about what life in yoga is, we have 6 services. We provide continuing medical education courses, measured yoga therapy, research in yoga therapy, free community yoga classes, programs to foster deeper learning in yoga, and these are typically on the spiritual end, and then workplace mind-body fitness program. And we have the next CME course that is coming in California is November 3rd and 4th. You can look up at our website. And I have a few more examples of measured yoga therapy, but then I'm going to stop over here since I'm out of time. We just finished 40 minutes.
Well, if you want, you can take 5 more minutes.
Okay.
Open up questions.
Let me take a feedback from people. The places where I hurried through, would they like me to go a little slower over there and go back, or go to the more of the examples here?
You can just type the chat button. I mean, the others, other people will respond to that.
Okay.
Examples.
Example is what people want?
Yeah.
Okay.
More examples, please.
So we will go straight to the examples then. Okay.
Not seeing anything.
Yeah, it's coming. 1 second. Okay. Okay. So here we go. To understand the power of this electrophotonic imaging that we use, I have a case over here where I have 2 people, and 2 people complain of the same thing. They're feeling they have persistent tiredness. And when these 2 people came, the 49-year-old female, she's a school teacher, mother of 2 children, who are all old, old enough, all of them, because she got married when she was very young. And so all of these children are like in the age group of 24 to 28, but no, maybe close to 30. And so this, in her case, since I've known them for a long time, she told me that every day, when she comes back from school around 3-4 in the afternoon, she has to sleep for 1 hour. And if she doesn't sleep, she cannot function. She cannot think. The mind is, she cannot focus anywhere. And she goes to sleep around 9 o'clock at night, and she wakes up around 6 o'clock in the morning. She has a good 9 to 10 hours of sleep every day. And even with all of that, she feels the tiredness. But of course, I also know, and she explained to me, she had told me she's very worried about her son, the older child, and he's not more serious about life and taking focused on career and things like that. So she's very worried about him. And so again, we took her reading, and I will show you in the next page what the numbers come out to be. And the second person is a 54-year-old person, a biomedical researcher, whose spouse is a physician. And this person was feeling tired most of the time. And in his case, he has no worries, but he has a workaholic lifestyle. So let's see what the numbers say over here when we assess them. When we assess these 2 people over here, this case A, hopefully case B is over there. Okay. In the case of case A, and both of them, I had them do exactly the same exercise. What is the same exercise? Deep breathing, what we call Bhastrika Pranayama. So that's what I had them do. So in the first case for this lady, you can see the cardiovascular system is a little low, respiratory system is a little low. You can see the endocrine system is quite low. The adrenals are very low. And you can see the immune nervous system are all low. After she did 3 rounds of this, you can see her numbers are coming closer towards normal. And if we look at the entropy change, you will find the biggest entropy change is the endocrine system, the hypothalamus, adrenaline, and nervous system. This is where you see the big changes, and you see very small changes in other places. In fact, no change in the respiratory system. The movement from 3.5 to 5.65 is with increase in entropy tells you there is no validity over here on the respiratory system. But the key activity is the endocrine system, nervous system. That is where you're seeing the big change over here. Okay. So now let's go to the other person. This other person, again, you see, I'm looking at exactly the same categories of the organ system energy. You can see how there are some similarities. And after doing that, you can see the numbers again change. But if you go and look at the entropy, what you find is the only change, or the only changes are in the thoracic zone, the respiratory side, respiratory segment, and in the hypothalamus, which is a stress factor. So for the person who is this workaholic, even though the symptoms of tiredness and fatigue are over there, it's a very different issue from a person who is worried. So you can see how the system captures the distinction, even while at the same time, you can see that the exercise to increase the vitality was exactly the same. Here is another case of a person who is an 82-year-old person. This is a classic example of a person who got completely messed up with toxicity of modern medication. At the age of 51, he had his first cardiac event. And after a few years, he started, and of course, after his cardiac event, he got put on very many medications and things. And as a result of the medications, he started having hyperacidity. So they put him on Prilosec also. And then after another 5 years, he developed a depression. And so they put him on depression medication also. And then about 4 years back, they added more depression medications. And at the age of 81, he developed COPD and was put on an inhaler. And at the age of 82, he developed uncontrolled belching. And so they gave him this muscle relaxant called baclofen and activated charcoal to help him with that. And that's when, after about 3 months of having all of this, 3-4 months or 6 months, he came to me. And when he came to me and we took the reading, by the way, here is the list of all his medication. And if there are any physicians here, they will recognize what all of this means. Now, after we treated him, after 5 weeks, the baclofen and charcoal was gone because he was no longer having the belching. Then, after another 2 weeks, so at the 7th week, they found the blood pressure was dropping so much, they got rid of his losartan with hydrochlorothiazide. That too was gone. And in those days, he used to, before he started this, after every 4 minutes of walking, which he would do, he would get a pain in his underarm that was like a slight angina pain. And he has to stop and take rest for a few minutes before he can walk again. After the 7th week, what he found is he could walk for 8 minutes, and only after that the pain would come. And most recently, 2 days ago, I had a phone call with him. Now he can walk without any pain for 45 minutes. And I've recommended to him, working with his doctors, to start taking out the Cymbalta and the Ramaron, which is the one which are used for his depression. I've suggested that they consider slowly reducing the dosage and make a plan where over a period of a year or two, they can take it out, is what I've suggested for him. But of course, I have no authority to tell him what to do on this, so he'll work with his doctors to deal with that. Now, any case, but these are the readings we got for him. Here I actually gave you the full screenshot, and we can actually see how when we saw his head elements, his coronary arteries, his nervous system were all weak. And then once he did the vagal stimulation, the Ujjayi pranayam, all of that became green. And then because of his cardiac condition, I also had him do a mantra japa. And after doing the mantra japa, it became even better. And you can see over here, his beginning stress level was 2.68. Then it came down to 2.44 after doing the vagal stimulation, 2.27 after the meditation. And the rest of these are all just numbers, but the effect I've already told you. So with that, I'll stop over here.
We'll open for questions, please. Take a couple of questions. Yes, Tiago.
Shanai from Raleigh. I missed to meet you last week.
Yes.
Saji, are you not doing any frequency-based medication, Ji? That is also going very well with your current approach, Ji.
What is frequency-based medication?
Chakra-based frequency healing.
Oh, okay. I understand what you're saying. In this system that I showed you, they have a way of also representing chakras. Okay. And they have developed a program whereby if you click on it, it will create a music that will help to balance the chakras. I've tested with it, and the chakras, what they produce in the system is actually a derivative and not the real chakras. And so the corrective program they build with it, it can have some marginal effect, but it does not have significant effect. But also what we do is we do use chakra vibration for healing. In fact, what we have found is, you remember the case where we spoke about, where I showed you the traditional medicine approach is looking at when we are measuring at the subtle body level. We don't have access to the causal body level from this system. Anytime there is a conflict between the subtle body and the gross body, all of that we are capturing by reading with the 3 fingers or with the system. Whereas when there is a conflict between the causal body and the subtle body, there is no way for this system to figure it out. But this generally manifests in certain kinds of conditions. If people have palm sweating, that's an indicator of that. When people have mental health issues, that's an indicator of that. When people have, very difficult conditions, incurable conditions like cancer, chronic fatigue syndrome, and things like that, that's an indication of that. Then we use chakra vibrations in order to clear all of them. So we do use them, but we use them differently.
Well, can I quickly pull out the chakras? Because, we use the same system. So just to show them.
Yes. Actually, I can show you a live chakra if you like right now.
Right. Okay.
Great.
Oh, there you have it over there. That's good enough.
Yeah. So this is some of the chakras.
If you look over here, this is the before and after effect that are being captured. This is the before and this is the after.
Okay.
So, Ji, is it similar to a Kirlian camera model or is it totally different?
No, it is exactly that.
Oh, okay.
Yeah, this is also published. I can send you this paper. You can take a look at it.
Please, that will be very helpful.
Okay, thanks.
Are you planning to share the recorded video, Sean?
Yeah, we're going to share this in YouTube. Okay.
Yeah, thank you very much.
Okay. I think we are, we have a little more announcements. If no questions, so we have a few announcements about our programs. And if there is, we can take one more question. If it's like a critical question, not anything about the important point that he talked. Nobody was asking about the politics of beyond the medical system, which is very important. And I think that
can I ask a question? This is Hariharan to Dr. Rajan.
Yeah.
Yes.
Dr. Rajan, thanks for doing this. It's a wonderful session. I'm basically an instrumentation engineer to finally see something getting measured uh, is wonderful, because that gives, as you said, that takes the guesswork out of the picture. So
Yeah.
my question is, um, is this a treatment-based system, or is it a lifestyle change? Do you teach or have a book or CD or DVD that you are going to promote as a lifestyle change of how you should do, or like daily practices that you should do, or
See,
just treatment based on yoga therapy?
see, the thing is, you ask a very good question, and time again, I tell people that the real approach of yoga is to change the inner person. In other words, the cause of the disease is you, and the cure is also you. So, in other words, when you're making a change in lifestyle, what do any of these practices enable you to do? First, you start with these practices. By the way, all these practices have to be done daily for a period of about 6 weeks for neuroplasticity to build in. Do you know what is neuroplasticity?
Neural pathways.
Yes, essentially what it is our brain, for any time you do these things, you're creating a new program within your system. And the new program, while you stimulate it, is in the temporary zone. For any program to sustain and be part of your system, there needs to be energy from the brain directed to it. And this is done by the new synapses created in the brain. So it is literally like the nervous system, the brain's system, changing to allocate energy for this new practice that you have created. Okay. Now, so what happens is it takes about 6 weeks for the neuroplasticity to fit in, but it has to be done every day about the same time in sync with your biorhythm. And therefore, we generally tell people you have to do for 3 months for results. And then the other thing that goes along with this is people automatically, as they are doing this, they become more aware of themselves. Finally, every yoga practice you do is really a meditative practice that builds inner awareness. And the inner awareness guides people into the right kind of lifestyle and behavior. When I was in that, when I was on the screen of the employer program, right at the bottom, there were two cases of a case of a chai yoga and another stress busting technique. Just to give you, they serve as very good examples. In one case, there is this 30-year-old person who actually we asked him to do, he was highly stressed. We asked him to do this Ujjayi pranayama for 15 minutes every day. And he did this first thing in the morning. He would go into meditative mode. And 1 month later, he came and told me, not only, and we measured it, his stress level had dropped, but more importantly, he said his productivity in work had improved because he had greater clarity in thinking, and he saw that his reaction was creating unproductive stuff, and he was able to better improve himself. Now, the second person is a person, similarly, he was stressed, and this person, man around 34 years old, with wife and 2 children, and both husband and wife working, very busy lifestyle. And when I saw his stress was up, I told him, you have to do some practice to address the stress. The first thing he told me is, I have no time. So when he told me about with my wife and children and work and all of this, I have really no time. So I asked him, how does your life unfold? What is the first thing you do when you wake up in the morning? So he said when he wakes up in the morning, he goes into the bathroom, and after washing up, he comes out and he makes a cup of tea. And at that time, he turns on the TV, the news. And of course, when he wakes up from bed, first thing he looks at his mobile for any email and things. And so I told him, I'm going to ask you, without just one change in your lifestyle, when you wake up, don't look at your mobile. And when you come to make your cup of tea, don't turn on the television. All through, just keep awareness in your breath. And when you're drinking your tea, which he loves to do. He takes 15 minutes to do that. I told him, just keep sipping the tea and keep your awareness in the taste of the tea and the breath. And so we called it as chai yoga for him. And 1 month later, this man who had no time for anything in life, he has started going to the gym 4 times a week, and he had found time in the evening. So as the awareness becomes better within, people will automatically change their lifestyle. Okay, so we also give counseling. One of the things we give counseling when we do this is how to fit the activity in what part of your lifetime. So when we take input information, we want information on when they wake up, when they go to sleep. Another important element we focus on is sleep. I don't know how many of you know, if you don't have adequate sleep, if you're waking up with alarm every day, then sooner or later over a period of time, your immune system will go down. Anybody who is listening over here, who spend longer sleeping times on weekend, you have to make sure you're in risk of that category. You need to make sure you have longer sleeping during weekdays as well. So anyway, with that, I'll end over there. So in other words, lifestyle, it will automatically change when you learn to connect with your inner self, and that's what yoga does.
Thank you, doctor. Wonderful. And we need to incorporate many of this that we learned today. So we are SiddhaVetha Center is teaching many of these courses. We are as transdisciplinary science and technology, lifestyle management is part of it. As you said, mindful learning, mindful eating, mindful living, and that's the essential part of SiddhaVetha courses. So this time we are opening 2 more courses in November and December. So one is a pain management course. It's a very short course, 10 weeks, like the HR Siddha course. Pain management is based on the Burma and ancient acupressure. Dr. Ravindran, most of you know, Dr. Rajan knows him, and myself, both are taking this course. And pranayama, advanced pranayama, was Sundar Balasubramaniam is going to take, and many of you know he has done a lot of work on that area. So we're going to introduce more courses. Interested people, please register our courses. Bring this ancient science and technology. We need people like Rajan, Narayanan, and all involved in this to bring this, CME credits and other things, and so it will be very useful. So as a team of people, we can bring ancient science and technology, and only then it's possible to change the world, because there is no other alternative ways, and we have a way. India has a lot of way. India and China especially, they have lot of techniques that are not coming to the mainstream. So if a lot of people push together, we're going to change this, and only through collective effort it's possible to change, not through individual guruism or any other way, so it is through collective effort. So I thank you all for your time, and Dr. Rajan, we appreciate your time. Wonderful talk. Thank you so much.
Thank you.
Thank you.